In December 2020, the second wave of COVID-19 hit Nigeria. By March, the country received about 4 million doses of vaccine. This brought relief to the economy as inoculation started and restrictions eased. However, the spike in cases in India and warnings from health bodies like the World Health Organization has brought restrictions back. How will both the government and the people handle this return of restrictions? We'll tell you how Nigeria is handling the pandemic on this episode of Special Report. You're welcome. I'm Ini John Mekwa. The coronavirus disease of 2019, codenamed COVID-19, gripped the world with a shock, overwhelming health system of most nations. The World Health Organization declared it a pandemic. It became a public health emergency of international concern by the 30th of January 2020, with over 7 million cases globally. By early June of the same year, United States has recorded over 2 million cases. Brazil had over 700,000 cases, Russia over 500,000, and in Africa, South Africa got over 54,000 infections, Egypt over 38,000.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus.
Mindful of what this will become in the nearest future, the World Health Organization got started with its countermeasures with the constitution of the Coronavirus Preparedness Group on the 31st of January in Nigeria.
The Multisectoral Coronavirus Preparedness Group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center. We have received a lot of cooperation, 2 visits already from His Excellency, the Ambassador of China, who has come visited us 2 times to reassure us of his commitment and to give us support in any way. They sent us a treatment protocol because they have successfully treated over 4,000 or 5,000 people in their country. They sent a treatment protocol which we have sent to our centers there to study and add to what they already know.
Nigeria, a country with 36 states and the Federal Capital Territory, was categorized by International Health Agency as one of the 13 high-risk African countries with respect to the spread of COVID-19. The country is among the vulnerable African nations, given the weakness of the healthcare system.
We are not struggling at the moment with healthcare professionals, either nurses, doctors, or ancillary support. And yes, we're receiving volunteers, people who have gone into early retirement are coming back, people who are allied healthcare professionals are coming back. They're going through training. We're training every day, Monday to Friday, sometimes over the weekends. So we're training several tens to hundreds of practicing practitioners and those that are volunteers. And we are ahead of the outbreak. So we have excess testing capacity, and with every day that passes, we are increasing our testing capacity.
According to the Nigeria Center for Disease Control, the training of the rapid response teams across the 36 states in the country was concluded in December 2019. On the 28th of January, the NCDC further revealed that a coronavirus group had been set up to activate its incident system to respond to an emergency. Additionally, the NCDC worked with 22 states in the country to activate their emergency operations centers to manage and link up with the national incidents coordination centers.
when there's a crisis, we need to learn from an approach that the military has really established. From a slow consensus building approach that we normally use in public health to a much more command and control style response. So we established an incident coordination center down here at our headquarters in Jabi in Abuja. We use the center once there's a crisis. In addition to our work in Abuja, we're supporting the states across Nigeria. We want every state in Nigeria to have a functional EOC from where they can mount a response. We've done this in 8 states. Our ambition was to get to 18 by the end of this year. Even if we don't get to the 18, we're sure we'll get to a critical mass and spend the rest of 2019 making sure that every state in Nigeria has an EOC that is connected online to the central center downstairs, through which we can coordinate our response.
Although the government has strengthened the surveillance at the airport since January 2020, Nigeria recorded its COVID-19 index case that was imported from Italy on the 27th of February. This raised concerns about the effectiveness of airport surveillance and, by extension, the country's general preparedness. The index case, an Italian, had visited nearby Ogun State before testing positive for COVID-19.
It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos.
Nevertheless, the onset of COVID-19 sent waves of panic across the country. Like in every other country, NCDC activated a multi-sectorial National Emergency Operations Center to oversee the national response to COVID-19. Subsequently, the Presidential Task Force for Coronavirus Control was inaugurated on the 9th of March 2020. The PTF then started enforcing guidelines that would further assist in cutting down the rate of infection.
The Presidential Task Force is escalating its surveillance and testing drive to ensure that the spread of the virus is effectively contained. We shall continue to remind Nigerians that all non-essential trips should be put off. This is for your safety and good health. And that's why we encouraging you not to embark on non-essential trips. And as much as possible, try as best as you can to avoid congregating in large gatherings and continuously avail yourself of the non-pharmaceutical interventions, the wearing of masks, the keeping of social distancing, the preservation of hygiene in terms of hand washing, and also the use of sanitizers. That way, we can keep ourselves safe, our families, and our communities.
Fast forward to June the same year. The phases of lockdown began, and then on the 6th of August 2020, the Nigerian President Muhammadu Buhari authorized the extension of a nationwide lockdown for 4 weeks as the country continued to fight against the COVID-19 pandemic.
To protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners. With this in mind, and having carefully considered the briefings and report from the Presidential Task Force and the various options offered, it has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days, effective from 11:59 p.m. on Monday, 13th of April 2020. I am therefore once again asking you all to work with government in this fight.
Further to reviewing the response nationwide, and with the conclusion that Nigeria is not yet ready for a full reopening of the economy, the PTF COVID-19 announced the extension of Phase 3 of the eased lockdown for a period of 4 weeks, effective from the 19th of October 2020. This was in line with amendments to address economic, socio-political, and health considerations, which includes maintaining the current nationwide curfew from 2 a.m. to 4 a.m., opening of the NYC orientation camps, gradual reopening of all educational institutions in a phased manner, maintaining the restrictions on mass gatherings outside the workplace to not more than 50 persons, removal of limitation on social servants allowed to come to work with alternate day arrangements, recommencement of sporting leagues, in particular all outdoor activities such as football, recreational parks, event centers and restaurants to open for outdoor service. As of December 17th, authorities in Nigeria maintain significant measures to help curb the spread of the coronavirus disease. Although international travel is permitted, quarantine requirements remained in effect for new arrivals. Outside of this, domestic measures were also put in place nationwide.
We have told them the inspection, prevention of the infection prevention and control of the COVID-19. We have told them the proper hand washing, how to wear the mask, how to disinfect their working environment, how to wear the face mask properly, and other things they need to know. We have told them that all these things has to be a culture and a tradition that has to continue for the time being as far as COVID-19 is still with us. And that is not what they should learn today and go back and do a different thing. It should be a continuous one. And they should go out there and teach others what they have learned. And so far, so good. Has been awesome.
International and commercial flights were ongoing. However, flights were only operating through Murtala Mohammed International Airport in Lagos and Nnamdi Azikiwe International Airport in Abuja. Currently, travelers arriving in Nigeria must present proof of having been tested negative for COVID-19, taking up to 120 hours before arrival. All new arrivals must self-quarantine for at least 7 days in the city of their arrival, regardless of negative test status. Travelers must also register on the Nigeria Center for Disease Control travel portal and must take efforts to register for a follow-up test once in the country, while evidence of this registration is required on entry.
What we must ensure that we do, and what we are doing, is to enforce, to make by force for you to wear that your mask while you are seated. To ensure and enforce that you are wearing that your mask. So we put everything in place to ensure, because we have some cantankerous passengers worldwide, not peculiar to Nigeria, that want to use their phones when we say don't use phone, because they don't see the reason. Well, thank goodness, with COVID, you have seen the reason, because you know people die. So it will be very, very hard to ensure that you put your mask while you're seated. If you don't, we consider you as an unruly passenger. An unruly passenger is not allowed to board our aircraft. Once you are an unruly passenger, if you start to shout, just shout, yeah, and you're disturbing peace of aircraft, no, the captain will not go, you'll be dropped.
Some of the challenges in Nigeria at the onset of the pandemic were the problem of contact tracing due to false or wrong contact addresses given by people who came in from Europe and other parts of the world. There were also a handful of COVID-19 patients who ran away from isolation centers in states like Delta, Oyo, Sokoto and Kano. This further put the state COVID-19 task force to commence intensive contact tracing and immediate decontamination. Nigerians felt more relaxed and relieved in the new year hearing the news of the shipment of the vaccine to the country. On the 2nd of March, Nigeria received nearly 4 million doses of COVID-19 vaccine shipped via COVAX facility. This introduction was the largest vaccine procurement and supply operation in history. COVAX shipped 3.94 million doses of the AstraZeneca Oxford vaccine manufactured by Serum Institute of India from Mumbai to Abuja. This empowered the National Primary Healthcare Development Agency to commence the vaccination of Nigerians in priority groups, starting with frontline healthcare workers.
This is the Presidential Steering Committee, PSC.
The announcement by the Presidential Steering Committee on COVID-19 of the transition of Phase 4 of the COVID-19 restriction threw a lot of Nigerians off balance.
The level of adherence to the use of face mask, physical distancing, temperature checks in public spaces, hand washing, and limitations placed on large gatherings remain very poor. In some areas, these are even non-existent. In line with the increasing risk of a surge in cases, the PSC is therefore maintaining the enforcement of the COVID-19 health protection regulation. This is to mitigate the risk of a spike in new cases while the nationwide vaccine rollout continues. The national response continues to focus on achieving a balance between preserving lives and livelihoods while working towards long-term epidemic control. Further to this recommendation, and effective from 0001 hours of Tuesday, 11th May 2021, this Phase 4 of the first restriction of movement shall come into effect. We shall maintain restrictions on mass gatherings outside work settings with a maximum number of 50 people in any enclosed space. Approved gatherings must be held with physical distancing measures and other non-pharmaceutical interventions in place. Enforcement of mandatory requirement of a 7-day quarantine for all international passengers arriving from foreign destinations, while institutional quarantine for international passengers arriving from the 3 countries we mentioned. Enforce temperature checks and no mask, no entry policy in all public settings, workplace buildings, businesses, places of worship, etc. Access to government and commercial premises should be denied to any person not wearing face mask.
However, this Phase 4 of COVID-19 restriction entails 12 a.m. to 4 a.m. nationwide curfew, domestic and international travel discouraged during holidays, government meetings and travels limited to virtual platform. In a new turn of event, the federal government has launched a 112 mental helpline to provide nationwide free telecounseling services for those adversely affected by the psychological effects of COVID-19 pandemic. The Minister of Special Duties and Intergovernmental Affairs, Senator George Akume, adds that the World Health Organization is supporting the drive, which he hopes will have a meaningful and sustainable impact on vulnerable Nigerian communities during and after the COVID-19 era.
The Strategic Preparedness and Response Plan outlines the public health measures that the Mindway project intends to implement, especially as it relates to mental health. The Mindway project is out to support the populace with free telecounseling services during this COVID-19 pandemic. The counseling will take into consideration what Nigerians and other members of the public have gone through during the period of the lockdown and other appropriate counseling services that could enhance mental well-being and foster community resilience. It is supposed to state that the World Health Organization has also welcomed this initiative and is ready to support the objectives of the Mindway project in providing free telecounseling services to Nigerians infected and affected by the COVID-19. In addition, the Ministry of Communication and Digital Economy has graciously provided toll-free lines for the services.
After going days without a single fatality, Nigeria has recorded its first COVID-19 death in over a week. This streak was broken at a time when it seemed as though we were experiencing a lull in the daily infection figures. Yet again, another reminder that the virus hasn't gone to sleep just yet. Muslims across the country celebrated Eid al-Fitr, marking the end of the month of Ramadan. It's the second of such celebration in the COVID-19 era. Unlike the previous year where prayers were cancelled, congregational prayers were allowed this year, but with a caveat.
Violations of these protocols, each state government to set up mobile tribunal for prosecution of violators, and security agents are empowered to make arrests for violations under the Health Protection Regulation. These safety protocols only provide a baseline from which state governments may further build on to strengthen their responses based on their local circumstances. States should continue to consider them as minimum guidelines required to ensure an acceptable level of epidemic control. Lastly, as we prepare to commence the end of Ramadan festivities and Salah celebrations, we urge Nigerians to be cautious, to avoid crowded places, and ensure that they continue to use face masks and also social distancing where necessary.
On the day of celebration, many dignitaries had put out notices to cancel all forms of public gatherings to comply with government laid-down directives. President Muhammadu Buhari had announced a private Salah celebration and a cancellation of homage paying during the Eid celebration, while the Katsina state government cancelled the annual Durbar. In the spirit of the times, President Muhammadu Buhari observed the religious rites with his mask on amidst family and close associates who also had their face masks on at the State House in Abuja. From the northeastern state of Nigeria, where faithfuls gathered for the Eid prayers, to the northwest, north central, to other south-south, southeast, and southwestern states, the day was marked with substantial adherence to wearing face masks and achievable level of hand washing and sanitizing. Before the index case was recorded, so much effort was said to have been put in place by the federal government to avert the spread of the disease.
Although COVID-19 positive cases have continued to drop even with sustained testing, we must remain on our guard. The lessons to be learned are quite simple. We have said them many, many times. Avoid crowds and mass gatherings for whatever reason, whether for politics, religious, commercial, or social occasions. Wear your mask at all times when you are outside your house. Do not accept to chat or do business with anyone who is not wearing a mask. Do not buy from a trader who is selling without a mask. Wash or sanitize your hands frequently, and cover your mouth when sneezing and coughing. These are very simple measures. And finally, take your vaccination when you are invited to do so without hesitation. These, I have read out, are our best chances of escaping COVID-19 infection.
If these protocols had been strictly followed without exception, a new phase of restriction would not have been needed. Most importantly, Nigeria's health care needs to be adequately reformed and all its facilities upgraded for more robust healthcare service delivery. Well, that's our story on this episode of the program. Don't forget that we always would love to hear from you. So send us an email, send us a tweet, ask us questions. We would like to hear from you. That's it for this episode. I'm Ini John Mekwa.